have believed for a number of years that it's important that we have an environment of continuous learning.
Right off the bat, I'll tell you that we spend about $11 million a year in this effort. We don't look at it as a cost. We look at it very much as an investment.
Because there's literature and data out there that shows those folks become very loyal, dedicated, long-term employees.
Norton is willing to put the work in to be a leader in this field. They're always trying to find ways to solve the broader healthcare hiring challenge, not just the Norton challenge.
Just being involved with CareerStat has helped us a lot. And we've been able to learn from them, take ideas and Nortonize them, so to speak.
Norton Healthcare invests in its frontline workers through the ELFI program.
We offer them educational opportunities to help them to improve their understanding of working in healthcare.
Where we're talking to folks about communication style and growing their confidence to show that you can do more than the job you come into in the organization.
Making those resources accessible is a way that we convey to the employee that we are about your success.
Data is at the center of everything that we do. We built a workforce development tool about 5 years ago to help us better understand how to utilize the data that we have. It's one thing to have the data, it's another thing to analyze the data and actually put it into action.
So when they're trying to make decisions on where to invest and why to invest, they start with the numbers, and that's where we come in.
Where are our trends? How is healthcare changing? Sitting down with our leaders and saying, where do we need to be making investments? And that comes internally as well as externally through partnerships with our schools, our colleges.
Norton collaborates with numerous community partners, whether that be our educational affiliations with over 100 academic partners, or our relationship with Kentuckiana Works, our workforce investment board.
Kentuckiana Works and Norton came together to really help the center come to life, if you will. We've been able to direct a number of individuals to employment opportunities with Norton and our other healthcare employers in the area and in the region.
This has changed my life, starting out as a medical receptionist at Physician Services and working my way up all the way to the DMP program. It's been life-changing.
The Norton Scholar Program, that's the one I took advantage of and get my degree and continuing to get another degree.
It was important because it allowed me to find out who I was as a person. And then I got to meet people who were on my side that helped encourage me to learn more and to do better.
To wake up and enjoy coming to work. I mean, I get teary-eyed just thinking about it. I started as a CNA 17 years ago. I am where I am now because of Norton Healthcare as an instructor at a community college. Last night I was awarded a Teacher of the Year, which is huge. I wouldn't have got that if it wasn't for Norton Healthcare.
I pause when you ask why is it important to invest in your employees. Why wouldn't we? Why wouldn't we?
Folks that are more joyful, folks that are more engaged, are more giving of the organization, and they're willing to be advocates. So when our employees are willing to advocate for our organization to say, this is the best place to provide care and this is the best place to receive care, then we know we've arrived.
The return on investment is really going to be around engagement, self-fulfillment, self-actualization of folks who work with patients and families on a daily basis. And that's why we all got into this business, was to be able to make a difference. And having an opportunity to empower people at all levels of your organization, and especially on the front line, to know how to do that and to be able to do it on a regular basis is really the true reason for investment.